attaches to T1 that C7 doesn't have? What attaches to T1 that C7 doesn't have? I think bone. Ribs. Okay? So when we go into flexion and extension, we're going to have much more mobility of C1 through C7 than we will through the thoracic spine, because the ribs are very constraining in the amount of movement that we're able to make. So to find C7, you're going to come in from the side. So I have my fingers and I'm spanning a couple of segments. Then what I'm going to do is I'm going to rest my elbow on the front of her shoulder. Go ahead and relax your head for me. And what I'm going to do, Jenna, is I'm just going to move your head back and forth a little bit. Okay? I know. Okay? And so this spinous process right here, when I extend, it disappears. And when she flexes, it pops back out at me. Similar to what we did for the proximal row carpal bones. So I know that that's C7. We're going to use C7 for goniometry. We're going to want it for a landmark if we find a dysfunction and we want to know what level we're at. So most oftentimes, one of the first things I'll do before I have the person lie down is I want to mark C7. Okay? So I would use the body pen that you guys have in your bags. What works, those things don't come off particularly well, at least they haven't in the past. What works a little better are the dry erase markers. They come off much easier. But I would just put a dot right at the spinous process of C7. Okay? Now, one of the other things that I would do to just get a general assessment of how the spine is moving. Now, this is a way upper level skill. I would like you just to practice it and just practice seeing what you feel. I'm going to put Jenna's spinous processes right in this crease. So my thumb is going to be to the left of her spinous processes, and my right finger is going to be on the right side. Okay, so I'm going to be like this. And then what I'm going to do is use my thumb as a fulcrum, and I'm just going to rotate her, and I'm just feeling how her spine moves. Then I come to the other side. And Jenna has some great mobility in her cervical spine. Now my guess is you don't move so well here. She's just real flat right there. But her cervical spine, I can't let you get away with me saying nothing bad about your cervical spine. But that is just a way, now I wasn't moving you a whole lot, right? No. That's just a way to see, a quick and dirty way to see if there is some kind of mobility impairment in the cervical spine. It really is meant to be a screen. You won't be assessed on it. It's something you'll come back to in a couple of years in the spine class. But just practice feeling with your hand what that feels like. Okay? Now, to palpate the spinous processes in sitting, can I have you go ahead and bend your head forward a little bit? So we had found C7, which I didn't mark. When you're doing spinous processes, you're always going to want to be palpating with multiple fingers. And always leave a finger on the spinous process you know, and then let your other fingers travel up until you get to another spinous process, and then you're going to travel up to find another one and another one and another one. But always have one finger on something you know. Okay? Now, C2, so first of all, C1 does not have a spinous process, so there's nothing to feel. Okay? And that's going to be up into the skull area. C2 is going to be the first one you can feel, and that's going to be tough, particularly in sitting. So here, I'm doing just a nodding motion to make sure I'm not on her skull. Okay, so this is the first one that I can feel, which is probably 3. Okay, so her 3 is pretty prominent. And then you can count down. So you can either find C7 and count up, or you can come off the skull and count down. Okay? Now, I would not palpate transverse processes in sitting. In all honesty, I wouldn't palpate much in sitting other than C7. Okay? So I'm going to go ahead and lay down on your back. See, Dylan, I had to kick out. You just go on your own. So now, when I have Jenna in this position, I'm going to be palpating with the tips of my third and fourth digit on both sides. And I'm coming in, and so first I would have done the assessment that I had shown you previously. Now I'm coming in, yeah, who's your partner?
Kelsey.
So her C2 is really hidden. The most prominent thing is C3. Now, the nuchal ligament is going to be a really thick ligament that goes from the skull down to the mid-cervical spine. And you're having to palpate the spinous processes through that. Can you go, do you have that slide? Can you go back a slide? So do you see at the top of the cervical spine, that thick ligament that's going from the skull down? That's called the nuchal ligament. It turns into the supraspinous ligament, and it turns into the supraspinous ligament at the point where it is going from tip to tip of the spinous processes. Okay? It's all one structure, it just changes names. But so to palpate the upper cervical spine is going to be pretty tricky because we're palpating through that nuchal ligament. Okay? Now, in the cervical spine, the transverse processes are going to be in line with the spinous processes. If you look at our model, transverse processes in the cervical spine are pretty unremarkable structures. Like if you look down at the lumbar spine, do you see how the transverse processes are these big sticks that stick out, right? Up in the cervical spine, they're these really small bumps. So it's much easier in the cervical spine to find the spinous process first and then work out laterally. Okay? So again, for spinous processes of the cervical spine, I'm palpating with these two fingers. And I'm just doing slight flexion and extension. So there's 3. Now I'm keeping one finger on 3 and I'm coming down and finding 4, leaving a finger on 4 and coming down to find 5, etc., etc. Now if I wanted to find a transverse process, so 3 is so easy on her, so I find 3, I'm just going to come out laterally, and now I'm going to go up and down, so superior, inferior, to find that transverse process. Okay? Now, if you look at our spine, the transverse processes in the cervical spine aren't going to be more than an inch out from the spinous process. So your fingers are going to be relatively narrow. Okay? Now we talked about the transverse process of C1 is we're going to find Jenna's mastoid, and we're going to come in between there, and we're going to slide on the transverse process of C1. Okay, so C1 is the exception to the rule of not palpating the spinous process first because there is no spinous process for C1. Okay, now the other way that I will assess the transverse processes is, I'm going to show you, because most of you are over here, and then I'll show you on this side. I'm going to use this hand to stabilize her head, and then I'm going to use the radial side of my index finger as a pressure along each segment. So I'm coming in here. It's still not very hard, right? Did you agree with that?
Yeah, no.
How about setting me up for that answer?
Wow.
Or maybe the C1, it looked to me from here like her head was moving quite a bit. What would that, isn't it not supposed to move?
Right. It depends on how hard you're pressing. So if you're pressing fairly hard, you're going to see some head movement.
Okay.
That was harder. Jenna has a relatively small space between her mastoid and her ramus, and so there's going to have to be some head movement there. But it's a great question. Okay? Now, you can also do all of these palpations in prone, You are going to want to make sure that the head is in neutral, so use the toilet seat, or you can have them put their arm up like this if you're more comfortable with that. Some of you have had the conversation that the toilet seat ends up getting the person really extended. That means you need to put more pillows under their bellies to get that more flat. But if you don't like the toilet seat, don't use it. And just have them go like this, or you can take a towel roll and roll it up and have them put their forehead on that as well. But for palpating the spine needs to be straight. Okay? The advantage of palpating in prone is that you can visualize the spinous processes a lot better, but in prone you're not going to be able to test how things are moving at all. Okay? So you really need to be able to palpate sitting, supine, and prone. Okay? So let's have you practice